Can you hear me, Bev?
Yes, I can.
Thank you very much. Thanks.
Good morning, Beverly.
Good morning, Peter.
It's a little past 9, so we'll give everybody another minute to get on. Okay, let's begin. Good morning, everyone. We're convening the meeting of the Public Health Committee. Today is January 29th. Welcome back, everyone, from Monday. And we're going to begin with remarks from the chair. So, Representative Steinberg, do you have any remarks this morning?
Good morning. No, I don't. I just want to make note that Senator Summers has indicated that she's tied up in another meeting, but hopes to join us shortly. Hopefully this will be a straightforward meeting this morning, Madam Chair. Thank you.
Thank you. Representative Pettit, did you have any remarks this morning?
No, ma'am. Ready to go.
Thank you. Senator Wong, do you have any remarks this morning?
No, madam. Good morning to everyone.
Good morning, everyone. So let's begin. Under Roman numeral 3, concepts to be raised. We have concepts 1 through 5. We'll follow the same process that we did on Monday. I'll give you a brief description on each of these concepts and then ask for a motion to raise them all by voice vote. if the motion's passed, if it's made and seconded, then I'll wait and see if there's any objections. And if there are, we'll move through it from there. So just as we did it last time, and I hope that everyone found that system worked. So let's begin with concepts to be raised. Number one is an act concerning the various revisions of statutes concerning the Department of Mental Health and Addicted Services. They put actually two proposals in here. One is about their electronic record keeping. It's really to move them forward. One of the things I think a lot of us heard about during the pandemic was agencies' ability to keep up with the needs of our constituents due to electronic records and computer issues. And so they had already been talking about this, I think as I remember it from 2019, and a need to get more on the same page with interagency communications via electronic record keeping. So that's part of this bill. The other part has to do with searches of patients' rooms and what the criteria of that is, how those are done in order to both protect staff and also give patients their rights of privacy. So those are the two pieces of that bill from the Department of Mental Health and Addicted Services. Number two is revisions to the statutes pertaining to discharge of the residential care homes. This is a bill that we did hear, I know, in 2020. And the Department of Public Health has brought it to our attention again. It really has to do with residential care homes complying with the home and community-based setting requirements in order to have Medicare and Medicaid services regulation, to meet those regulations and get the full federal funding. So they have been working with all the stakeholders. There's a lot of strong feelings on both sides. I think it's important that we hear this again and look at this issue and continue to support them as they try to come to a consensus among everyone. Because the bottom line is that we may be losing out on federal dollars if we don't somehow find a way to solve this. The next one is the Department of Public Health's recommendations regarding remote access to medical records maintained by hospitals, healthcare providers. So again, looking for that record keeping and sharing of information. This is to have remote access to electronic medical records that involve reportable diseases, emergency illnesses, and health conditions, and reportable laboratory findings when the information is requested for disease control and prevention. It also creates a pilot program that allows access for electronic medical records related to birth, fetal death, and death occurring in the hospital. So once again, these are concepts, and we will hear more about those when they move to a public hearing. So if you have concerns about any of these issues that come up, you can always raise them during the public hearing and have your questions answered. The next one is about newborn infant health screening. This is just to tighten up some of the statutory language in this. It would require that specimens on infants be collected within 24 to 48 hours unless it's medically contraindicated, and that it would be given to the state public health laboratory within 24 hours of collection. Right now, we can blood spot screen for over 60 to 40. We have a lot of more information both about testing for them and treatment for some genetic abnormalities that come up during these tests. And so it's really important that we make sure we're testing our infants and treating them as early as possible if we can. The next one is an act concerning amendments to the marriage certificate. This would allow the sex to be amended on a marriage certificate following a gender transition. We have been looking at that for some other legal documents, and this is to update the marriage certificate so that the gender could be changed. So those are the 5 concepts to be raised. Can I have a motion to raise concepts 1 through 5 by way of a voice vote without objection?
So move, Representative Cook.
Second, Representative Bennett.
Thank you. If there are any objections, please raise your hand in the participants and we will certainly discuss those. I'll give everyone a minute to make sure they have the opportunity. For those new to the committee, we always try to give our agencies the courtesy of raising what they think is important. We have hearty public hearings where we can, question and ask about those concepts and whether or not we really want to make sure that those happen, and they still go through the same voting process. So, but just so you know, traditionally we like to raise their concepts.
And if I might, Madam Chair, we only do this after we've had the opportunity to meet with the agency. So at the very least, they've had an opportunity to explain why these bills are important to them. So we're not just taking them carte blanche. We do have a back and forth.
Exactly, which is why I was able to explain them. Otherwise, I doubt that would have been possible for me. So, okay, I don't see any objections. So, oh, I'm sorry, Senator Wong.
Thank you, Madam Chair. No objections. I was hoping to be able to just make a couple of quick comments on them and just go right to the vote if I could.
Absolutely, go right ahead.
Thank you. Yeah, indeed, number one, I appreciate the good work of Demas and their collaboration with the leadership of the committee. So I want to thank them, and I'm eager to look at some of the possible changes. Number two, I know this was a bill from last year, and I did get a chance to read it. And I was just hopeful that if we do have existing language, even though we're raising it as a concept that from a transparency in a Zoom world that we live in, that we're affording that language for people to get a heads up on it. Number three, I think it's important in this day of COVID to have access to medical records, but I think it has to be balanced with patient privacy and data privacy. So those were the three areas that I wanted to point as a point of consideration. I'm happy to raise it in support of it as a concept, but these are some of the comments that I wanted to make. And I do want to thank again publicly the chair's good efforts in collaborating with the ranking and making this committee work effectively in this time of day. Thank you.
Thank you, Senator. Okay, with that, I think that we can go to a voice vote. So would everyone please, face needs to be on screen and you need to go off mute. So please make sure that you are visible and that you are off mute. And I give everybody a minute to do that because you don't know where they are, what they're doing. And now I've been on a couple committees where they call it and everyone's panicking. So I want to give everyone a chance to get on screen and get off mute. So may I have a voice vote to raise concepts 1 through 5? All in favor?
Aye.
Aye.
Opposed? Hearing none, thank you. Well, we will move on to Roman numeral 4, which is a proposed bill to be reserved for subject matter public hearing. This bill is the act prohibiting the sale of cigarettes, tobacco products, and electronic nicotine delivery systems and vapor products by healthcare facilities and pharmacies. This is a bill that we heard previously. And it really speaks to the fact that if you're going to be a business or a place where you are serving the health needs of people, that it's very much a mixed message to be also selling tobacco products. So it is a bill that we heard, and during that testimony that we heard last time, we know that there are some municipalities that have already addressed this. We know that there are some businesses that testified, some large businesses who already testified to say that they've already done this voluntarily. So we think that it's important that we hear this subject again. Again, this is just to go to the public hearing to hear it and to talk to the people who would be most affected by it and listen to whatever comes out of it and then determine whether or not we want to move ahead with it as a committee. So I would like to again raise this for a voice vote if there are no objections. If there are, please raise your hand and I will call on you. Oh, I'm sorry. First, I need a motion. Can I have a motion to raise this with a voice vote if there are no objections?
Second.
So I think that was Senator Kushner and Senator Haskell.
Madam Chair,
Yes.
The bill is supposed to be reserved for a public hearing, not to be raised.
Oh, I'm sorry, did I say that wrong? I apologize. Thank you.
So say it again.
So to reserve this, okay, we'll try this again. I apologize. I have to get all of this language correct. So we are going to take a voice vote to reserve this for a subject matter public hearing. Do I have a motion?
So moved.
Second, Michelle Cook.
Thank you. So moved by Senator Kushner, second by Representative Cook. And I see that Representative Betts, go ahead.
Thank you and good morning, ma'am. I just have a question. You had mentioned in your description that some of the pharmacies have already done it voluntarily. So it sounds to me as if it's, business by business. Why would we want to make a state law if they have the ability to do this on their own, or if they choose to do otherwise? Why is the state mandating that when it seems to be more of a business decision?
Well, I think that would be a good conversation for us to have after we hear from the different businesses. And that's what the public hearing is about, to hear all that information, to let everybody on the committee hear it and decide whether or not your question is really the question. So.
Okay, thank you.
Representative Carpino?
Thank you, ma'am. My question's a little bit more on a logistical matter. I say that we're talking about raising it for a subject matter public hearing, but I thought that next week on Monday, we're also hearing vaping related issues. And this is a difficult process. So this more of a comment, not a question. This is a difficult process for our constituents. Zoom is not as easy for folks as we think. I just asked the committee leadership to please keep our constituents in mind when we're scheduling things. If these are truly overlapping topics, I ask that we have these issues on similar days as we move forward. And I'm not blaming anybody. I don't mean to be critical, but I want to make sure that we keep our constituents in mind. It's particularly when we can no longer go bill by bill by bill. If folks are going to be randomly testifying on any given day, I think it'll be much more efficient for our constituents to be able to testify on similar topics on one day as opposed to rearranging their schedule multiple times. Thank you.
Representative Carpino, your point is so well taken. And it is certainly something that we are going to attempt to do a better job with moving forward. As we started this process, we're trying to do it the best we can, but your sentiment is exactly the sentiment that the leadership of this committee has.
Thank you,
So
ma'am.
apologize for this one and for the lack of consistency with that. But this is one of those things that came up where we realized that we really need to do a better job.
We'll get there.
exactly
Thank
what we're
you.
talking about. So thank you for bringing that up. Any other questions or comments before we vote? So we have a vote before us to reserve this bill for a subject matter public hearing. Seeing no objection, would everyone please take yourselves off mute and put yourselves on camera? And we will have a voice vote. Thank you very much. All in favor, say aye.
Aye.
Opposed? Thank you very much. Please put yourselves back on mute. Next, a couple of announcements. First,
Madam Chair, are we going to just make clear that we're holding the vote open?
yes, thank you. Thank you for that. We will hold the vote open for 1 hour let's say 1 hour from now.
Very good.
Thank you.
Madam Chair, if I may.
I don't know. What, you have to raise your hand, Representative.
Oh, sorry. Okay.
No, that's okay. Go ahead.
Sorry. All right. I apologize. I will raise my hand
It's
in the
okay.
future. So are we holding the votes open? It was 2 voice votes, or are we holding attendance open? I'm a little confused.
Effectively, we're talking about the same thing since we had a voice vote, but I have not checked attendance, so we want to afford people a chance.
Okay. All right. Thank you.
Next on our agenda, we have a public hearing.
If I might, Madam Chair, I'd be glad to take this one on.
Yeah, I'll make the announcement of the dates and times, and then if people have questions, we'll do a share How's that?
Okay.
So Monday, February 1st, we have the start of our first public hearing. You should have received a link. And if you have not, please reach out to either our administrator, Madam Henry, or one of our clerks, or Representative Steinberg or myself, and make sure that you have that link. And I would suggest you do that sometime today to make sure that you have what you need to participate. And then on February 5th will be our next committee meeting. So just want to make sure you're aware of both those dates, but more importantly, I want to make sure everybody has the link and that they need to be on the public health public hearing on Monday. So are there any questions about that or anything we need to discuss?
Senator Wong
Senator
has his
Wong?
hand up.
Go ahead.
Thank you, Madam Chair. If I may, and I might have missed it, and if it's not too much of an additional burden, given that Monday we will have our first public hearing, I just checked the committee's website and I didn't see it, but I was hoping that we had some guidance and directions for people that want to give testimony to have readily available, information and guide. For example, what's required for them to sign up for, a slot for testimony? How long of a time do they have? Where do they go into a waiting space? This is obviously new. Having observed what happened in transportation earlier this week, it's all learning curve, but having some sense of a guideline or a how-to information for the public health access, we're going to have a lot of people that's interested, and we want to be able to make sure that information is readily available and they don't have to search through the myriad of menus, submenus within the CGA site. If we could, as every committee member, have that how-to sheet that we could provide to constituents that want to provide testimony and get an opportunity to do so on Monday, it would be a great trial run for many of the other upcoming controversial issues that we may have. So I don't know if there's any such sheet that's available or if I missed it, but if there is one, I would love to be able to have it, to be able to share on the website through social media with my constituents that want to have a voice on Monday.
I think it's great, Senator. We have put together a virtual committee meeting and public hearing protocols page, which I think is the basis for what you're talking about. But if you've seen any other committees do something that's very clear along those lines, that would be great as well. We can certainly have some things readily evident on our webpage that help people through this process. So we will take it under advisement, and if you have any suggestions, would be much appreciated. But we do have public hearing protocols that we can share around and use that to create sort of an FAQ for this purpose.
Thank you. That'd be very helpful. I appreciate it.
I think, Senator, as well, you bring up a good point, and I think for those of us who can, to share our social media that these are the topics that are coming up in the public hearing on Monday, and any way we can spread the news and make sure people are aware, I think that's a great idea.
And since we're on the topic, in anticipation of some other questions, let's talk for a minute about how we expect things to go on Monday, in that it is our first public hearing. For example, we will have a sign up. And unlike what this committee has done in previous years, where we heard each bill's testimony iteratively sometimes, in this case, because of the nature of sign up, a citizen can testify on any of the bills on that day's agenda when their turn comes up. So it will not be done by bill, it will be done by the sign-up order. We are still reserving the first hour for public officials and agency experts because we want to afford them a little bit more focused time. They're often the ones who can best answer the questions that committee members have. So we want to afford them that chance for that first hour. Obviously, after the first hour, we do the traditional alternation between the public and officials. What else can I tell you? People will have 3 minutes. We may afford a little bit more time for the agencies depending upon the nature of their presentation, but 3 minutes will be strictly adhered to. We'll ask our clerks to assist us with this. We'll be as gentle and as civil as possible in getting people to conclude, as we always do. Obviously, committee members can ask questions, which would extend the period in which we interact with a particular person testifying. But that's been our practice in this committee. We will probably even more so when we have long public hearings, want to make sure that people are being respected for those 3 minutes, but do not abuse it. I see that even though I've tried to explain everything, it's actually generated 3 questions.
Can I just say too that please make sure that you have the phone numbers of or some way to get in touch with maybe other people on the committee, or some way that if you're experiencing a difficulty, we're going to follow the same process of hand raising as we go through the public hearing if you have questions for the person testifying. So just to make sure that no one gets shut out accidentally, make sure that you have somebody or several people that you could text and say, I'm trying to raise my hand. I haven't heard that that's been a problem, but I just want to make sure that if anybody's having a problem, we don't shut them out inadvertently.
So should we address questions? Representative Betts, followed by Representative Dauphiné.
Hey, good morning, Mr. Chairman. Thank you very much. I have a quick question, which is dealing with legislators who may want to have a constituent testify like they do at a public hearing. Is that still going to be allowed?
That's more of a challenge logistically, but a great question. I don't know how you would necessarily couple you and the constituent at the same time. We're going to have to look into that, and we'll get an email out to everybody. I'm not sure how we would pull that off logistically.
Thank you.
All right, Representative Dauphiné, followed by Representative Pettit.
Good morning, and thank you. My question is, for those that would be testifying on more than one bill, would they be afforded 3 minutes for each separate topic? How would that work?
Well, the way we've done traditionally is they have 3 minutes and they can comment on as many bills as they choose.
For each bill, each separate bill, Mr. Chair?
They get their 3 minutes in the sun and that's it. I know it's a
Okay.
challenge, but that's the way we've always done it.
Okay, thank you.
Representative Elliott.
Yeah, my question is, if people can sign online from anywhere, what are we going to do to keep this from being a 72 or 20-day hearing?
Well, I would say don't make future plans on some of these bills for the following morning. We will have some bills, probably no more than 1 or 2, that will definitely try everyone's endurance. And it is our obligation to afford everybody an opportunity to testify, and that's precisely what we're going to do. You know, we talked about trying to find some way to show preference for Connecticut citizens. There's really no effective way of accomplishing that. We're just going to, you know, grin and bear it and listen to everybody until everybody's had a chance to speak.
I mean, it's ostensibly feasible that this could be like the public could filibuster our hearing. No?
We're working on T-shirts that say "I survived the hearing," and all I got with this T-shirt. But no, I don't mean to be totally facetious. That's the process.
Okay.
It may not be ideal. You know, we want to try to keep any committee meeting or hearing from being manipulated by any outside party. But we are going to bend over backwards in favor of access. That's our guiding principle. And it may mean on some occasions we feel as if something has been orchestrated, but that's the way the cookie crumbles.
All right. Best of
And
luck.
there's always been an element of that. So, you know, it's not unique to this. It might be different in the way it manifests itself, but it's not unique to this process.
Well,
I just say that
somebody-
I'm sorry, go ahead.
Somebody from like a different country could
Yeah.
attend this hearing.
Mhm.
So I think it does feel a little different. I mean, we'll see. So I just wanted to flag that.
Of course. I just want you to know that I received notice that there's a good explanation on how to testify under the public hearing notices. So I'm going to go check there when I get off of this meeting, and I recommend that any of you do the same. So under the notice for the public hearing, apparently there is some information about how to testify. So we'll look at that and maybe we use that as our jumping off point if we want to add anything else. I'm sorry, Representative Cook, my apologies for cutting in front of you.
No, it's totally fine. You are the chair. I just have a question to the chairs, actually. I know that I had mentioned earlier on about splitting the committee, especially in a couple of those very long, and we know they will be long public hearings. Have you all had any investigation and update on that possibility? And then my second question to that would be, I understand that Bev will be doing yeoman's work from her location. Now, my question for that is, obviously we have the 3-minute bell. Will she have the ability at 3 minutes to hit mute for anybody that's testifying? How will that work so the general public also understands that as well?
Yes, I believe we have the ability to mute. I think it's the same way that we've always tried to be gracious and respectful of people testifying. I would not want anyone to think that, you know, they would just be muted. You know, here's your 3 minutes, boom. But of course, that's always been something that we've worked to do, and there is that possibility.
It is a challenge to give a person an opportunity to finish their thought. Some people, like me, have thoughts that last for paragraphs. So we'll do the best we can, and we will try to respect people's right to testify. But as everybody knows, there are some people who just don't stop when we tell them to stop. So we may have to do what we have to do. As far as your first question, Representative Cook, we have investigated the prospect of dividing the hearing. We've been told that's not a good idea. So that's not what we're planning to do going forward.
Thank you.
Representative Zupkis.
Thank you. And thank you, Mr. Chair. I guess now we know we can mute you when you're thinking. Just to let you know, I was sat on the first public hearing in transportation, and they did a wonderful job. It was, they did not mute anyone, but the clerk did at 3 minutes instantly say, "You're almost at your 3 minutes. Can you wrap it up?" It was very respectful, and everybody was, the public was good with it. There are some other challenges, but that was very simple. Just wanted to tell you that.
Yeah, but that was transportation. They have it easy. Right?
Well, wait till we get to tolls.
Representative Zupkis, thank you for that. And I do think that we are trying to learn from one another in these committees and make sure
Madam
that
Chair?
we're looking at best practices. Yes.
The public hearing will not be much different. It's just that it's virtual. And I had shared some information that some announcement that the chairs will make at the beginning of the hearing, basically asking members of the public who are coming to testify that if it becomes disruptive, the chairs will have the right to shut their mics down or to remove them from the hearing. The announcement about your 3 minutes, that will be the chair's responsibility. We will find a way to either text the chair and let the chairs know, or the chairs will. We don't have a timer in Zoom, so it's a little bit difficult. But the bulletin notice is online just as we did in the past. There's no difference. So the public will go to the bulletin. The registration information is out there. So everything is still the same. It's just that we're virtual and we're doing things a little bit different. For example, public health will no longer hear bills in the bill order because that's a little bit difficult. But the sign-up sheet will be posted the day before, the afternoon before the hearing by 6 p.m. So members of the public who sign up to testify will be able to go to the Public Health Committee's webpage, see where they are on the list, and have an idea what time they will testify. As we go along in a long hearing, the chairs will be asked to make announcement that we're now hearing from attendee number 75 or attendee number 10. So someone who is like number 80 will gauge themselves to know exactly what time their name will be called. So they won't be sitting around like we did in the LOB.
Thank you.
Thank you for
It's
that.
a new world, so it's a little different, but it's almost the same.
And not to build too much confidence, but I want you to know that Representative Steinberg and I have both been chairing informational hearings since this summer. So this won't be our first time running a Zoom hearing. And so we do have a little bit of experience in that. So I hope that for any committee members who haven't had the opportunity to do that yet, through some of the informational hearings that happened, I want you to know that that Representative Steinberg and I both have. So hopefully that experience will pay off.
We'll still mess up, but hopefully not as frequently. Representative Carpino, followed by Representative Pettit.
Thank you, sir. I'm on the same trend I was on earlier, which is access and making it easier for our constituents. Is there anything to prohibit us from putting information right on the agenda as to how people can testify, so that when you click on the agenda, it's great. We know where the bills are. There's a link to, in theory, the language of the bills. But the average individual who wants to testify isn't necessarily going to know where to go. We might have an amazing explanation somewhere else, but they're not going to know where to go. And they're not going to be able to call us over a weekend to ask. I mean, they'll call some of us, but they're not going to be able to reach out to Beverly on Sunday to say, how do I sign up, particularly on a Monday morning? So if there's nothing that prohibits us from doing so, and not just public health, I'm going to mention this in all of my committees, why can't we either put a link or short explanation and a link on every single agenda telling folks how they would testify? Because they're not going to the bulletin. They're not going to a committee page.
No, I think that's a really good point, Representative, and I'll check into it. It's one of those things that sometimes there are things we're able to do as an individual committee, and sometimes we're prohibited from doing it, depending on what the rules are. But I think you bring up a good point, and I'd be happy to check in and find out.
Thank you,
I
ma'am.
promise you only one thing. We will not be flawless out of the gate. But these are good ideas. We're learning as we go along here. I expect by the time this committee is done, we'll have learned quite a bit and we'll be even better. Senator Moore.
You might be on mute. I think you're on mute, Marilyn, or Senator Moore.
Good morning, everyone. I've listened to the conversation regarding our constituents being able to understand this process. And I think we would be doing a disservice if we didn't do something that was uniform from committee to committee. I think when you think about public health and human services and children, those three committees, and insurance, often have the same people who want to testify. And I think it would be very confusing and do them a disservice if we all had a different policy. So I think this needs to come from another place and not committee by committee. That's just my comment, to make sure that everybody has the same information. Thank you.
I'll say two things to that, Senator. First of all, we are all adhering to the same rules as negotiated by our leadership. And secondly, to your point, we'll be glad to share what we're doing with other committees to try to achieve some consistency. But it is not within our power to dictate to other chairs how they want to handle their committees. There is a measure of discretion involved. But I think it's a wise idea for us to share what we would call our best practices for managing a public hearing, and we'll be glad to do so.
Representative Foster. I just want to ask, is it possible that in these public hearings, as we're talking about concern about access, it might be a way for us to understand if there is a concern, and it also kind of gets at that, like, are people speaking to the people who represent them? Because I, of course, want to know, and weigh more heavily, the people who I serve and represent. Is there a way for us to ask each speaker their address, as they do in most municipal meetings, to confirm residency before a moment of speaking? That way we can say, oh, this person who's coming here lives in the 57th district, and and we can have that in our head as information that we're sharing.
We did explore that. It was a thought we had as well. We were told that would not be in conformance with the rules. There's nothing to say that in an interaction with a particular person testifying, you could ask a question as to, maybe where they live or the like, but not as a routine matter with everybody coming on to testify. So, generally speaking, we hope the vast majority of people are Connecticut residents, but we know some people won't be.
And it's our understanding that people are not required to share that, even if you ask them so.
Representative Cook.
had in our past, mind you, I've only been here for a few years, that when somebody came up to the front to testify, they gave their name and either their address or the town they were from. Am I losing my mind in that regard, or did I not remember hearing hundreds of people say, I'm Michelle Cook, Torrington, Connecticut?
You know, I recall that as well, which is why I thought when we asked the question, we would have gotten a different response. That may be more of tradition than of the rules in this particular session, but we were told we could not require that they answer such a question. I'm not sure as to the rationale, except the answer was no.
Interesting. Okay, thank you.
Representative DeGraw?
Yes, I just am thinking about it in terms of we're all concerned about making sure that everyone has access. I actually this week sent out to everyone on my email list instructions on how to be able to access all of these meetings. I've posted on social media as well. My concern is the same as Representative Foster's in terms of, you know, it does limit the folks that are residents of Connecticut, that we are allowing folks out of state to testify on legislation that doesn't actually affect them since they don't live here. That just seems to be rather concerning in terms of the process and making sure that we are letting our residents have their say and their voice heard. That I think that would be a hindrance on our residents, and I just wanted to express my concern over that as well.
You know, the chairs kind of agree with you, and that's why we asked the question. And we were disappointed by the answer because we think it would have helped direct the legislation to those directly affected. But that's the answer.
Yes, we advocated, you know, before the joint rules and since, and, you know, we've been asking these same questions, and those are the answers. So I don't see any other hands raised. So
Explicitly, we're going to keep the meeting open for attendance purposes. We'll be in recess for 1 hour for attendance purposes only, at which time the meeting will be adjourned.
Thank you so much, everyone, and look forward to seeing you all on Monday.
Thank you.
Good weekend.
Don't hesitate to reach out if other things occur to you before.
Thank you.
Bye.
Thanks. See you Monday.
Have a great weekend, everybody. Be safe.
Lindsay.
Henry.
Hi, Lindsay. You're looking good.
Oh, thanks. So are you.
Hey, you still got the same cell phone number, right?
Yep.
Did I talk the other day? Okay, I got, in case I need to contact somebody, I got to check with Beverly too. Thank you.
All right. Talk to you later.
Have a good weekend.
Hi, good morning.
Good morning.
Hi, Beverly. Hi, Lindsay.
We had 2 voice votes, so you've been present, you're all set.
Thank you. Senator Castro votes yes to both voice votes.
Thank you.
Thank you both.
Thank you. Bye-bye.
Have a great weekend. See you on Monday.
You too. Bye.
Lindsay, is she the only person that was left?
Yeah, so I think it's probably fine to just close it at 10:15.
Yes, because it's voice vote, it doesn't matter.
Yeah,
Roll
and
call,
we-
we have to wait.
So
And
you
we're
think
live
that-
on YouTube. I'll call you in a few minutes.
Okay.
Okay. Or can you set up a quick Zoom and we just jump back on?
At 10:15, right?
Yes.
Okay.
Okay. Are you gonna stay on until 10:15?
Yes.
We were only waiting for attendance.
So it's okay for us to close it?
It's okay because she showed up, because she was the only person that was absent from there earlier, right?
Yes.
Yeah, you can close it.